Good morning. My name is Abdulhamid, and today I will present to you an information session from the Multicultural Association of Fredericton about mental health overview and services available. In the beginning, I would like to mention that I am not a social worker or psychologist or psychiatrist, but I have a training as a mental health first aid instructor. Let's first talk about health. What we mean by health. It is a state of complete physical, mental, and social well-being, not only the absence of disease. We all try to have a good health by doing things such as taking care of our food, doing regular exercise. But unfortunately, most of us don't take care of their mental health. What we mean by mental health? Mental health is the capacity of each and all of us to feel, think, and act in ways that enhance our ability to enjoy life, deal with the daily life challenge which we face. It is a positive sense of emotional, spiritual well-being that respects the importance of culture, equity, social justice, interconnection, and personal dignity. Our physical and mental health are interconnected. So if we have any problem in our physical health, it will most likely will affect our mental health. And if we have problem in the mental health, it can affect our physical health. Both mental and physical health are the result of complex interplay between many individual and environmental factors, such as family history of disease, our genetic makeup, lifestyle, example smoking, exercise, levels of personal and workplace stress, our coping skill. When the demands placed on someone exceed his coping abilities, his mental health will be negatively affected. Example of common demand: working long hours, having a chronic disease, or unemployment. So what we mean by mental disorder? Mental disorder is a recognized medically diagnosable illness. It results in significant impairment of an individual's cognitive, affective, and relational abilities. Mental disorder result from biological, developmental, and or psychological factors. So to be diagnosed with mental disorder, you need to be seen by psychiatrist or psychologist who will check with you the symptom you're having, and according to specific criteria the doctors have, they can diagnose someone to have a specific mental disorder such as depression, schizophrenia. Mental health problems can range widely from mild problems such as low mood, sleep difficulties, or excessive worries to severe disorder such as schizophrenia, bipolar disease, or severe depression. So good mental health will benefit you. If you have good mental health, it will increase your coping skill. It will be easier for you to handle difficult experience and stressful situation. It will improve your self-esteem. It will make you more confident in your abilities. It will improve your resiliency. It will increase your ability to successfully move on after a negative event and regain control of your life. So it is very beneficial for everyone to have good mental health. Currently, we have a pandemic situation caused by new virus, which is called COVID-19. This virus infection affected people in many countries all over the world. COVID-19 pandemic causing a negative impact on Canadian mental health. A recent poll found that 50% of Canadians reported worsening mental health since the pandemic began, with many feeling worried and anxious. It is likely that this impact will be serious and long-lasting, with certain people at greater risk of developing more severe mental health difficulties. Common feeling people can have during the pandemic: people are struggling with fear and uncertainty about their own health and their loved one health. They have concern about employment and finance, sense of being socially isolated due to public health measures such as quarantine or physical distancing. Sometimes they feel helplessness, bored, lonely, depressed. So people can react to stressful situation in many different ways. Now we will talk about the mental health continuum. What we mean by the mental health continuum? It is a range having good mental health at one end, mental illness at the other end. And depending on the internal and external faculties of the person at any time, he can lie at any point in the mental health continuum, and he can shift position in his situation depend on his situation, if it improve or deteriorate. In simple words, it is continuum, and we can be at any point in this continuum depend on our mental health condition. And we can see it is double-head arrow. This means we can move from good mental health to mental illness, and also can move in the opposite direction from mental illness to good mental health. So now we will talk about some example what we can feel if we are at the different point of this mental health continuum. So if we have good mental health, we will have normal mood fluctuation, we are calm, have good sense of humor, performing well, sleep well, have few sleep difficulties, physically well, have good energy level, physically and socially active, no or limited alcohol use or gambling. This is if you have good mental health. If you face some stress and you start reacting to it, you can have some of these symptoms. Become irritable, impatient, nervous, sad, sarcastic, forgetfulness, trouble sleeping, intrusive thoughts, nightmare, muscle tensions, headache, low energy, decreased activity, regular but controlled alcohol use or gambling. If the stress affects you more and start to cause injury to your mental health, you will be anger, anxiety, sadness, negative attitude, poor performance, poor concentration, restless, disturbed sleep, recurrent image nightmare, increasing aches and pain, increased fatigue, avoidance, withdrawal, increased alcohol use, gambling, which are hard to control. When the situation gets worse and the person will have mental illness, he will have angry outburst, excessive anxiety and panic attack, depressed, suicidal thoughts, cannot perform duties or control behavior, cannot concentrate, cannot fall asleep and stay asleep, sleeping too much or too little, physical illness, constant fatigue, not going out, alcohol or gambling addiction. So these some of the symptoms which you can have in every step in your mental health continuum. So again, to summarize, the mental health continuum, you can be at any point of this continuum from good mental health. Then when you face some stress, you can react, and if the stress affects you more, you can have injury to your mental health. then you can have mental illness. And we mentioned some of the symptoms you can have at every point in this continuum. And again, to emphasize that it is double-head arrow. You can move from good mental health to mental illness, and from mental illness to good health. Some tips about how to take care of your mental health. Currently, everyone follow on the news about what's happening regarding this pandemic situation. So it is good to stay informed, but always try to check reliable sources and always take breaks from social media and the news. Local health authorities tell you to have physical distance to reduce the risk of infection. So you need to have spacing when you mix with people. But physical distancing does not mean social isolation. Stay socially connected with your friend, family through emails, phone calls, video chat, social media. Practice things which keep your mental health under control, such as stretching exercise, meditation, deep breathing exercise. Try to eat healthy, regular meals, exercise regularly, and sleep enough regular hours. Think about how to use any unexpected flexibility in your daily routine. Focus on the positive aspect of your life and things which you can control. Forget about things which you cannot control. Be kind and compassionate to yourself and others. If you can, limit your use of substance. And if you use substance, practice safer use and good hygiene. In the next few slides, I will give you some information about mental health services which you can access when it is needed. The first one is Dr. Everett Chalmers Regional Hospital. Our hospital have emergency department, and the emergency department have on-call psychiatrist daily, and the psychiatrist can deal with any mental health emergency. So if anyone feel he got mental health emergency, he can go to the emergency department, which is accessible 24 hours a day, 365 days a year. This means it open 24 hours every day, including weekends and public holidays. And this for any mental health emergency. We have Fredericton Addiction and Mental Health Service. This is a specialized center for mental health issues such as addiction treatment, counseling service, therapeutic groups, and after the working hour, you can still access their service through what they call it mobile crisis service. So if anyone have mental health crisis, they can call their number and the mobile crisis team will reach to your place and will deal with the mental health crisis. Another service available in Fredericton, Fredericton Family Enrichment and Counseling Service. It is not for-profit community agency dedicated to provide counseling service and mental health education. You can access their service from Monday to Saturday, and you can call them, book appointment, and you can go there for any service related to mental health. The last service we will mention is SHMU Helpline. It is a provincial crisis phone line which provides a free, confidential, bilingual crisis intervention service to all residents of New Brunswick. They help with mental health issues such as thoughts of suicide, emotional distress, addiction, abuse, loneliness, and depression. And this phone service accessible 24 hours a day, 365 days per year. So also you can access it in the weekends and in the public holiday. So now we reach to the end of this information session. I hope it was useful information for everyone, and I wish everyone good mental health, and stay healthy and stay calm. And now we will have some time for any comment or question from your side. Thank you.